Body sculpting has taken a new high-tech twist. Liposelection, it's called. It's replacing liposuction as a way of nudging stubborn fat from unwanted places. 9 News medical reporter Dr. Stephanie Clements shows us high-def liposelection in a patient who works out a lot but says he's got nothing to show for it.
And John has some good material to work with.
Material John O'Brien is sick of.
To help us define his underlying anatomy.
That doughy softening around the belly that hides all of John O'Brien's hard workouts.
I work a desk job 40 hours a week, so I'm not getting the results from working out the way I would like to get the results, and I'm working just as hard as I did 10 years ago.
He runs, he lifts, he cycles.
Some fat's just not going to go away.
And still, his stingy genetics don't let the muscle definition show through.
Contract again, John.
But plastic surgeon Dr. John Millard can make it happen.
Towards the end of the procedure, and we'll actually sculpt out the tendinous insertions over this muscle.
After months of research, John O'Brien is having liposelection, high def brought to the body to put fat in its place.
This is a genetic fat that in the 21st century, you know, in the time of drive-thrus, and we know where our next meal is coming from, really isn't, it's sort of residual leftover.
Dr. Millard selectively removes fat along the contours of muscles in John's abdomen, sides, flanks, and pecs.
This is what makes high-definition liposelection possible. The VASER probe vibrates at about 36,000 times per second. That softens and teases the fat away from nerves and blood vessels, so there's less trauma and more contouring than conventional liposuction.
The recovery is much easier, too. This is John just 1 week after his liposelection.
I love what I see so far.
He's still swollen and has a normal amount of bruising, but he says it never was painful.
I can tell already that in the next few weeks after the swelling goes down, I'm going to have a nice tight 8-pack and a nice sculpted, torso.
If you do this and continue to work out or start to work out more aggressively, this will actually become accentuated.
John O'Brien says he'll always work out.
I don't consider it cheating. I consider it living better through technology.
Technology he hopes will pay off when he looks in the mirror. Dr. Stephanie Clements, 9 News.